name is Igor Volovich, and I'm the CEO and founder of RoadDoc. We're building a decentralized healthcare ecosystem to access underserved populations who are critically, chronically out of access to healthcare. Our initial target market is U.S. truck drivers, and we're going domestic first, which represents a TAM of $5 billion in annual recurring revenues. The problem is pretty serious. There are 4.1 million drivers on the road every single day. They have poor access to care. It's inconsistent. It's not quality. By the time they get to care, it's usually emergency or urgency. And they're 70% obese, 54% smoke. They eat very unhealthy, as we know. And they only see a physician once every 2 years on average because that's their DOT physical, that's mandated. They have a lot of chronic conditions, poor health outcomes. Average life expectancy is 61 years, which is 15 years less than the average American. And with the average age of 46, they've got about 15 years left to live. So it's a pretty dire situation. Also, it's important to remember that one in four veterans is actually a truck driver in the U.S. There's significant impact that goes beyond the drivers themselves. There's economic impact. Of course, the companies suffer from unplanned driver downtime. Every day a truck is standing still and it's unplanned for, it's about $1,000. If a truck stands still for 3 days, that actually goes red for that month for that truck. So if you multiply that, and with the margins being as thin as they are in that industry, it's a significant concern. So it goes beyond the drivers. It's also a significant economic impact. It impacts our national transportation grid as well. The answer is the RoadDoc autonomous health pod. The idea is to deliver these at truck stops where the drivers already are, and we're not chasing them, they're not chasing us, we're just meeting in the middle. And it's at the point of need, and we can provide clinical care without incurring clinical overhead. So we're not building clinics, these are fully autonomous, they don't have to be staffed, and in fact you are getting a true clinical experience in the pods with telediagnostics and AI-driven intake and triage. The GTM strategy is pretty simple. We go to where the truckers are, and there are truck stops. There's 2,000 major truck stops around the country. There are primarily 3 brands. It's Pilot, Flying J, Loves, and BP, and it's now a TA Petro. So 2,000 truck stops. We can go across the nation. We can cover major truck routes pretty easily. There are thousands of carriers. They hire from hundreds to thousands of drivers. So the access model is fairly easy, and we can get pretty close to our revenue very quickly. The model is B2B2B. So we are a care delivery platform. We extend the reach of individual practices without incurring significant overhead. They don't have to build out clinics. They simply plug into our network, and then they get access to patients, so there's patient capture. There's also care continuity, because when you see a physician through our platform, you see the same physician no matter where you are in the country. They also get all your records, so there's that true care continuity and clinical significance. So they're not seeing a random doctor every time when they get into Plush Care or Teladoc or something like that. The commercial carriers, for them, that's a fleet wellness management system. So they get to augment their existing systems if they have them. If they don't, that becomes their fleet wellness management system. And they get to manage risk from unplanned driver downtime. For the travel stops, very easy. It drives traffic, and they want it, all day. Unit economics, pretty simple. We understand things from a care encounter perspective. We understand things from a technology perspective, and we are technologists, so we understand how to build this. In fact, we're not reinventing any wheels here. In fact, we're just building a bicycle out of existing parts. So on a per patient basis, we're looking at about $1,200 in annual recurring revenue, and we're tracking to about 83% gross margins. Financial projections, we're looking at about $1 million ARR within the first year of beginning operations, and then reaching to $36 million by the end of year 3. There are a few prior attempts to do this. Folks have run into several problems. One of the primary problems is the care continuity problem, where they are unable to follow the patient across the country because as they transition with different geographies and different networks, they don't have their records. So somebody walks into a clinic, it's a de novo encounter, and they have really no background on them. And with chronic conditions, of course, that's very difficult to manage, almost impossible. One interesting example is Forward. That's a company out of California. They've raised $325 million to build similar pods. Very futuristic, and they've pivoted lately to the tune of $100 million to build the pods. They've built 19 clinics and no pods yet. So we know this is an existing problem that other folks have tried to solve. We've got a different approach, and we understand those problems. We've got early traction and support. American Legion is definitely in our corner. They've got 2 million members who are veterans, and of course one of our veterans drives a truck. And we've circled $600K in early revenue from early adopters in South Carolina and Illinois. The team is experienced. We've got plenty of exits, and we've done a lot of ventures. I personally have been involved with 35 startups, and we've got clinicians, we've got partners who are very experienced, and we are on track to produce a prototype within the first 3 months of operations once we gain our funding. We're raising 3 million seed, 500K for the prototype, and then would love to welcome you to join us on this journey. Thank you.